Yeah, and thanks so much for having me here. It's been lovely to see the speakers so far and such a beautiful turnout. I won't need to introduce myself too much. I'm Julia Packard. I'm the Alcohol and Other Drug Counselling Practice Lead from Thorne Harbour Health. I'm an occupational therapist by background, and I also have worked across alcohol and other drugs, mental health, sexual violence and homelessness sectors. As is custom in Australia, I would like to acknowledge the Wurundjeri Woiwurrung people whose lands I work and live on, and where Thorne Harbour Health set up. I'd love to thank all the organisers as well for having me here. So I'm here to talk about Thorne Harbour and our journey from our activist roots to providing a holistic and inclusive LGBTQI+ health service with a focus on our AOD work and our response to chemsex through our public health campaigns, peer outreach and programs. And I'm slightly nervous, so sorry if I stumble a little. Okay, so Thorne Harbour Health originally was called the Victorian AIDS Council, and we formed initially as a grassroots and activist-led community response to the HIV and AIDS epidemic. And we are an Australian-based LGBTQI+ community-controlled organisation working for our sex and sexuality and gender diverse communities. And this year we proudly celebrated our 40th year anniversary, and this picture here tells part of our history and is of an ACT UP demonstration in Melbourne on Flinders Street steps during the height of the HIV epidemic. So I've included a map here of Australia for context, and we're located in those two southern states. Our country population is over 25 million people, and the states in which we work, Victoria and South Australia, have a combined population of over 8 million. Australia is home to the oldest continuing living culture, with Aboriginal and Torres Strait Islander people having lived in harmony and connection with the lands for over 65,000 years. And Victoria, where Thorne Harbour originally started, is one of the most culturally diverse societies, with 27% of people speaking a language other than English at home. Other common languages spoken are Mandarin, Vietnamese, Greek and Punjabi, and people follow 130 different faiths in our states. And this diversity requires from us a need to be intersectional, thoughtful and strategic when delivering our services. So we receive state and federal funding for our work, and we partner with many fantastic organisations. Thorne Harbour Health was founded by volunteers, and our strong connection continues today. And we're lucky to have a huge number of volunteers, some of who are pictured here, who support us in the work and ensure we're listening to community and reaching as many people as possible. So in terms of more recent history for LGBTQI people in Australia, this picture is from the day we found out the positive results on the Australian plebiscite for marriage equality. And in December 2017, the right to marry in Australia was no longer determined by sex or gender. You can't see me in the picture here, but I was there with Thorne Harbour colleagues way in the back. We skipped a conference to go celebrate with each other. So look, our transition from an HIV-specific service to a more encompassing LGBTQI health provider, with one of our focuses being on substances and chemsex, was a logical progression. This pivot acknowledges the interwoven nature of alcohol and other drug issues, sexual health and HIV care, recognising that substance use has been a significant aspect of many queer scenes and LGBTQI scenes. And due to the intertwining roles of drug use and sexual engagement, a specialised lens is necessary to understand and address the resulting health implications. Narratives in healthcare and other settings often frame gay, bi or MSM sex as inherently risky, a perception that compounds the complex relationships between mental health, chemsex and HIV. And our service deliberately takes an alternative position, and our ethos aligns with sex-positive attitudes and adopts a harm reduction approach towards substance use. And this stance is vital in addressing the unique health challenges faced by our communities, especially when considering the enduring legacy and trauma associated with HIV and criminalisation of homosexuality within MSM communities. So by addressing issues associated with chemsex holistically, we aim to mitigate both individual and community harms, fostering a more inclusive and supportive environment. And the image here is from one of our campaigns around STI testing. So over the years, as the HIV epidemic has changed, Thorne Harbour has evolved to ensure we are responding intersectionally to the multiple areas impacting our communities. Within our current scope of practice, we're responding to sexual health and bloodborne viruses, including HIV and Hep C, STIs, drug and alcohol, mental health, intimate partner and domestic violence, trans health, lesbian, gay, queer and bisexual women's health, homophobia, transphobia, stigma and discrimination. And we do this through a three-armed health promotion approach of public health and policy, peer-based work including our outreach programs, and our programs which include direct practice, therapeutic and medical teams. And our overarching aim across all facets of health promotion and engagement is to provide timely and culturally appropriate education and support. This way, our community are empowered to make informed decisions that work best for them. We recognise that substances can be incredibly valuable and useful for people in their lives and can also intersect with people's lives in ways that can cause a multitude of harms, many of which are compounded by the illegality of substances and the scrutiny and stigma that LGBTQI+ people and drug users face. So our therapeutic programs, oh good, that fit in there. I wasn't sure if the slides would work, encompass our alcohol and other drug team, which is where I work, also our family violence, domestic and intimate partner violence, and general counselling. And across these programs, we provide therapeutic groups, peer-led groups, individual counselling, and family inclusive approaches. We also have outreach counselling and intensive case management to meet the needs of some of our most marginalised community who face additional barriers when trying to access health treatment. And importantly, all these services are free. Our teams work alongside one another, which allows us to respond sensitively to co-occurring domestic violence and drug and alcohol issues. And we work both with people who are experiencing intimate partner violence and domestic violence, and also the people who are using violence. And it's not always a binary, there are people who fall into both categories. And we have found that holding the domestic violence and AOD work together is essential to provide nuanced support, which takes into account the complex interactions and the impact of substances on relationships and violence, and appreciates the unique intersections of power and privilege in our sexuality and gender diverse communities. In addition to multidisciplinary support across family violence and AOD, we are also co-located with our peer-based medical service, Pronto, which provides rapid HIV testing and sexual health screening. We're also co-located with our centre clinic, which is a general medical clinic, and our specialised medical clinic for trans and gender diverse communities called Equinox. And this co-location means that once we're supporting a client with their substance use or their family violence, we can easily link them in with sexual health care or vice versa. For example, a young trans person might be accessing Equinox for hormone replacement therapy and then get linked in for AOD counselling to support their heavy use of benzodiazepine or cannabis. Or an older cis gay man might be coming in for counselling around an abusive partner, and there might be meth involved. And while we're safely exploring that relationship, we might link him in to some HIV testing because he hasn't accessed that before. In Australia, a common treatment modality for substance use is counselling, and that's what I do predominantly. And what many mainstream AOD services fail to do is to bring sex into the counselling conversation. And at Thorne Harbour Health, we provide a culturally safe context to explore drugs and sex, pleasure and play. And given the histories of our communities and prevalence of chemsex, if we're not talking about sex, we are missing out on the reasons why and the context of people's use, and therefore miss out on vital harm reduction opportunities. In conjunction with our harm reduction approach, the principles that underpin our counselling work is being trauma-informed, client-led and sex-positive. And sex-positive aims to remove stigma and shame from all sexual choices that are made consensually. We use sex-positive practice alongside a queer-affirming approach and the principles of sexual health to support people to talk about consent, how consent is negotiated, and we work with the goal of safety and pleasure. Now on to some of our group programs. One of our unique and specialised groups is Rewired, which is a free 8-week group for gay, bisexual and MSM who want to better manage their mental health, methamphetamine use and general wellbeing. And this group focuses on topics including relapse prevention, methamphetamine and the brain, sleep, nutrition, HIV, sex, pleasure, mental health, and mindfulness. And Rewired overtly addresses the potential interplay between methamphetamine use, sex, and HIV. And this group is run by clinicians with lived or living experience. And since this group ends after 8 weeks, we've been running it well over 10 years now, and what quickly emerged was an interest in having an ongoing peer-led space to continue meeting and talking about use and its impact on their lives and the changes they wish to see. And what was born out of this is Rewired 2.0, which is our ongoing fortnightly peer-led group. And through evaluation of this group, members shared with us that one of the things they found most useful and unique was having a space with other MSM who had similar experiences to talk with and share about the intersections of drugs and sex together. In addition, through engagement in this group, community members remain connected to Thorne Harbour, which means an ongoing pathway to other health needs as they emerge, whether that's through HIV support or rapid HIV testing, counselling, intimate partner violence support, or a pathway into volunteering or becoming a group facilitator. And Thorne Harbour sought out independent evaluation for this program in November 2021, and here are some of the quotes that clients shared as part of that evaluation. I'm so grateful for this group. I'm not sure I would have done this well without it. It is 100% an ongoing part of my continual plan to stay off meth for good. This is the most welcoming group for homosexual men I have ever been part of. I have recommended it to friends of mine who are in a similar scenario to myself. And this evaluation determined that the group demonstrated positive impacts, including reduced risky and other drug use, particularly methamphetamine use, and reducing self-stigma and psychological distress. And now just a quick look at some of our public health initiatives. So Down and Dirty is an interactive, not safe for work, so maybe don't Google it in your work time, depending on where you work. It's the kink-focused, sexually explicit website that provides education and answers from medical professionals and experts on different sex practices, including kink and chemsex. And connecting to community is a vital part of this health campaign. We utilise real stories and real questions to ensure we're both representing and responding to community needs and telling their stories. One of the functions of this webpage is a space to submit anonymous questions and have them answered by doctors or sexperts. An example of some of the questions that are on this webpage is someone asking about the impact of injecting methamphetamine into their penis, the interaction of meth and poppers. Another question comes from a man in his 50s who wanted to know about the risks associated with regularly smoking or injecting methamphetamine following a triple bypass heart surgery. And these are some of the questions that people might feel too embarrassed to ask their doctor, but they've got a space to ask that and still have it responded to by a doctor, but it remains anonymous. Down and Dirty also have created a cruising guide to assist people in navigating sex on premises venues and cruising spaces. And also during our long lockdown in Victoria, they had many live online sessions exploring the world of kink and community through storytelling and conversation. Another of our public health campaigns is Touchbase. It's an LGBTQI+ AOD website which provides accurate information about drugs, their interactions with other drugs, and most importantly, their interactions with HIV medications, Truvada, PrEP, and interactions with hormone replacement therapy. In addition to information on substances, there is a wealth of strategies, tips, and support around partying, sexual health, navigating both wired and sober sex, consent, and also how to seek help if you're concerned about yourself or someone else. It's engaging, accessible, and since January 2021, we've had over 295,000 users. Seshed is another one of our online platforms accessible via Facebook and Instagram and provides timely community-led harm reduction resources. They promptly disseminate information on any drug alerts that are identified by our Department of Health, and they provide community resource tips for partying and staying safe. Again, it's community-led, responsive, and really easy to engage with, and quite colourful. And finally, on to some of our peer-based and outreach interventions. As I said earlier, we have a rich volunteer history at Thorne Harbour, and our peer workers, both employees and volunteers, are an integral part of our work. So Party Project, which Thorne Harbour run in connection with a local health service, is a peer-led lived experience team improving the safety of people using party drugs. And it came about as a localised response to a spate of overdose deaths and hospitalisations from tainted party drugs in a clubbing strip in Melbourne. It were drugs sold by MDMA, but they had a psychedelic drug involved with them as well. And these peer workers have provided outreach training to clubs and bars, including delivering overdose and harm reduction training to security guards, bar managers and staff. And another branch of their work is providing harm reduction sessions to peers and community members to improve safety when partying. The Sexually Adventurous Men project, which is connected to that Down and Dirty website, have led outreach responses to sex on premises venues, gay clubs and parties. And while some of the outreach is done under the guise of handing out safer sex packs, again, our care and intervention goes far beyond that. So they also partner with queer community events, art spaces and organisations, and promote sexual health engagement through advertisements on apps such as Grindr or Scruff. And many successful positive partnerships have been formed because Thorne Harbour and our outreach team are active and visible in sex-related spaces for the LGBTQI+ community. A recent successful intervention to share with you as part of our outreach response was there was a sex on premises venue hosting semi-regular fetish parties, and prior to our outreach intervention, the party was seeing roughly 5 to 10 ambulance attendees at the party each night. And our intervention saw outreach workers attend about 20 parties there, which resulted in the ambulance call-outs being reduced to just 1 ambulance attending per event. So the outreach workers not only provided brief intervention to anyone clearly heavily impacted by substances, but also upskilled venue staff on identifying and responding to overdose, and providing a proactive and health-led response to clientele who appeared heavily substance affected. So we encourage them not to not let people in if they were substance affected, but to let them into the party, have them sit down, give them a cup of tea, let them become healthier and more well rather than leaving them on the street and being vulnerable. And again, those accessing the brief intervention from our outreach peers were also provided with referral pathways should they be interested in it. So it might be giving them the number to contact our alcohol and drug team if they wanted any ongoing support, or it might just be giving them condoms for the night or connecting them with our Pronto rapid HIV testing. So I've mentioned Pronto a few times, but here's a picture of some of our Pronto work. So it's a peer-led health service for men who have sex with men and trans and gender diverse people. So rapid HIV tests and standard STI screening are conducted by our peer test facilitators, and if further healthcare is needed, they can link them in with a nurse or doctor. And we have 2 permanent sites for Pronto in Melbourne, and as you can tell by this picture, we're also mobile, and Pronto can be rolled out and operational at community events to extend their reach. And whilst people may access Pronto initially for HIV testing, again, it's an incredible entry point to a range of healthcare responses, and often the peer workers link clients in with other services across our organisation. And again, that peer work is so vital because people, because of shame or stigma or just not accessing health services before, might have never been able to speak about what's happening to them. And that friendly face as a peer worker might be the first time they speak about substance use issues or intimate partner violence they're experiencing. So finally, just some key takeaways. As you can see at Thorne Harbour, we utilise a holistic and integrated multi-level approach to meet our community's health needs, whether that's through individual counselling to manage the impact of chemsex on their relationship, rapid HIV testing at an event, or finding a specific health advice, whether anonymously through our Down and Dirty website or through one of our medical practices. And what we have learned in our 40 years is the importance of continuing to listen to community, integrating HIV care with AOD, family violence and other healthcare, and that peer work and outreach is crucial for us to meet and respond to our communities. A sincere thank you to everyone again for having me here. And I'm around obviously for the rest of the day and also speaking on a panel later, so I'm really happy to answer any questions you have about Thorne Harbour or our specific services. And yeah, I work in the AOD team, so I know a lot more about that team than the other one. So very happy to answer any questions people have for the rest of the day. Thank you.